Hey guys, Ross here, Fit for Life Physical Therapy. So today I just wanted to talk about some simple techniques that we can go over for mid-back pain. A lot of people will report kind of mid-back pain right into this region, and a lot of us kind of bend from there. So whether we're sitting or we're standing throughout the day, whether we have an anterior pelvic tilt or forward head posture, a lot of our pressure goes towards our mid-back. So with that increased curvature or increased kyphosis that we have, the muscles get stretched and then we feel that tension throughout the day. And then the tighter that becomes, that can cause more stress to our low back and also our neck. So again, it's really a vital area, and it's often an area that I find is forgotten. So anything we can do to loosen it up is going to be beneficial. So for this, all we'll need is a foam roller. So I just have that placed right on the ground, and then I'm going to lay right over it. So you can start kind of mid-portion of your back, just kind of find a hot spot. I like to place my hands either behind my head, hugging myself, or kind of straight up towards the ceiling. So really the benefit to placing your hand behind your head is you can support your neck. When you place your hands around you or up towards the ceiling, it's going to spread your shoulder blades out to the side so that you can actually get some of those muscles that are on the inside of the shoulder blade. So you can start off with any one that you want, and usually I'll recommend going up and down 10 times. And again, if you want to make it a little bit harder, again, just get your shoulder blades out of the way. Once we're done with that, we're going to stay right on top of the foam roll, place my hands behind my head, and again, to support my neck, but to also make sure I'm not leading with my neck. Oftentimes, I'll ask patients to lean backwards over the foam roll, and they'll just go with their head. So we don't want neck movement, we want mid-back movement. So I always will say, try to keep my nose and my elbow in line, and then that way I ensure that I'm bending from my back. So I'll kind of go up and down the spine. I can do 1 repetition, I can do 5, I can do 10, whatever you want. So that's going to work on extension. And then the last one that I like to do is rotation, because generally if extension's limited, then thoracic rotation is limited as well. So with the foam roll, I'm going to bring my hip up to 90 degrees to help stabilize the low back, and so that my hip's not crossing midline. And then from here, I'm just going to try to open up the book in the other direction. So I'm going to spin, I'm going to try to touch my opposite shoulder blade flat to the floor, and then rotate back over. So you can do repetitions up to 10, 20, whatever you feel comfortable with, or you can even hold it for time. So once I get to the end here, I can take a deep breath, and as I exhale, I should feel my body start to loosen even more. So again, I'll try that for about 10 repetitions. Ideally, what we want to see is that repetitions 1, 2, and 3 probably aren't that easy. 4, 5, 6, get better. 7, 8, 9, 10, you feel the most loose that you're going to be. And a lot of this, as I've said before, is consistency. So I'd rather see you do it 2 minutes a day, 7 days a week, compared to 1 hour, 1 day a week. Once you get some of the mobility back that is lost, then you can start picking and choosing when you want to do it. So really the big thing with this is consistency. So if you are having mid-back pain, if this sounds like it's you, give these 3 exercises a whirl. If you have any questions, let me know, and thanks for watching.